Hello, we're going to talk today about CIHI's Health System Performance Framework. We're going to look at the role of frameworks and the components of a framework and how they fit together. And then we're going to look at a framework in action, which is really key to understand how a framework can help inform health system performance and measurement. So why does a framework matter? Well, a framework guides the development and provides context to health system information and reporting. It also helps us select appropriate measures, and it helps us identify where there might be gaps and areas and opportunities to measure more things that we're not measuring. More importantly, it provides that common set of language or concepts that all the stakeholders in the system can relate to as they work towards measuring and delivering on the goals of the system. So CIHI's Health System Framework is unique in that it's really focusing on the broader system as opposed to a healthcare framework. And that's really important because it's looking at the broader system, it's helping people understand the evidence base behind the framework, so it's very comprehensive. It looks at the dimensions of performance, but also the context around the system. And we'll see that in a visual later on. It's built on robust theoretical foundations and various models of care. And importantly, it's aligned with what the priorities of the system are, so that people in the system can see their work and see how they're managing the system through this framework. How was it developed? Through a lot of consultation and expert involvement, as well as looking at what exists out there in frameworks internationally. So there's a lot of great work done internationally in the OECD with their frameworks, the World Health Organization, the Institute for Healthcare Improvement, Triple AIM. Those are all important concepts around patient-centeredness, value for money. Those are all concepts incorporated in this framework. And we built on our existing framework that we have, a classification framework with Statistics Canada for health indicators. So we took that, added the new models of care, built in dynamic relationships and causal relationships, and have built a system framework that responds to the whole system and its context. We're going to take a look now at a visual of the framework, and I think it's important to look at the visual to sort of see how the components come together, and we'll walk through each of the quadrants. You can see from the visual that the CIHI System Performance Framework is comprised of 4 interrelated quadrants. And those quadrants have arrows that run between them, and when we talk about thinking about the causal relationships, we look at each of those quadrants as how they affect and impact on each other. So let's start with outcomes. If you had an example of a health status outcome like avoidable mortality, well, we know that that's affected by timely and effective health services, and those are really the characteristics and the outputs of the system. Inputs such as policy interventions and leadership and governance and public health programs also affect avoidable mortality. So that's why we bring in the inputs and the connections with that. And then the system itself, in collaboration with other sectors, influence the social determinants, which can also influence our avoidable mortality and preventing death as a health status. So that's an example of how the framework can be dynamic in nature. So as we start to think about the individual quadrants, we can start with the outcomes as a natural starting point, because these are the ultimate goals of the system. So when you look at the framework, there are 3 overarching goals that are identified. 1, improving the health status of Canadians, a common goal. Making sure the system's responsive, so is it responding to society's values around what we expect for our healthcare system? And improving value for money, and those are really important aspects around, are we delivering the care that we really achieve with high quality for the right resources that we've input into the system? So these 3 strong goals are also based on an equitable distribution of care, because we really need to make sure that we're providing this care equitably across populations, whether it's males and females or through different population groups. So looking at the social determinants of health, this is an important part of a Canadian health system framework as opposed to a health care framework. So the social determinants of health, they provide insight into the health of the population as well as inequities in health. There are two main components: structural factors, which include things like income, social status, education, and literacy, gender, ethnicity. And then you have biological, psychosocial, and behavioral factors. And these are all the things that comprise the genetic background of a particular person, the neighborhoods they live in, the housing, their stress, sense of control, and smoking, physical exercise. So those are all the things that can affect a person's health. The system itself can also affect social determinants and influence them. So if we introduce a smoking cessation program, then we can reduce some of those behavioral factors that can affect the health system. When we think about the characteristics of the health system, we think about outputs. So outputs really are those intermediate objectives that lead to the ultimate goals that we're trying to achieve in the health system. So this quadrant focuses on two components: the capacity of the system to deliver high-quality healthcare services and the quality attributes of how those health services are delivered. So when you look at this quadrant and you see the four boxes, those quality attributes are things like person-centeredness. Did we achieve patient-centered care in the delivery of the care? Was the care safe? So as an example, if we have an infection in hospital, that can lead to a poor outcome. So we really want to make sure that that care is safe care. Was it appropriate and effective? Did you get the care you needed it when you needed it? And was it efficiently delivered? And those are all the characteristics of health services that help to determine what our ultimate outcomes are. So what do we need to understand when we think about framing the system and explaining how health system performance works? Those are the inputs and characteristics, and that's the quadrant that really focuses on the levers of health system improvement. So when we think about that, we think about leadership and governance. So how is the leadership driving health system improvement and quality? Resources, so both financial and human resources. How do we allocate those resources to achieve the services we want to achieve? And evidence and guidelines, so things like clinical practice guidelines. Are we using evidence-based information to ensure that quality of care? So these are all inputs and characteristics that are levers that inform the health system. So we've looked at the framework and its components and the quadrants, but it's important to consider the overall contextual environment that the health system operates in. So when we think of the contextual environment, we think of things like the cultural factors, economic factors, the political context, the demographic context. These are all things that can influence how the health system operates. So examples could be macroeconomic policies and how that might affect how you deliver health care through the funding, federal government policy changes and funding mechanisms and how that can influence. So these are all important contextual factors that really we can't manage the system without understanding these factors that surround it. In addition to the larger, broader CIHI health system performance framework, CIHI has also developed cascading frameworks to allow people that work in a particular service area, such as long-term care or acute care, to help them provide clarity into how their specific actions at an organization level might relate to the larger system level. So the cascading frameworks help to define the boundaries between what an acute care hospital might look at in terms of what the system might look at. And it helps those stakeholders understand how their actions might contribute to the performance of the overall system. So the cascading frameworks are important to look at, and even from a jurisdictional perspective with their own frameworks, they might want to look at how their framework aligns with the broader overarching health system performance framework. So let's take a look at the framework in action. And one way to do that is to take a particular problem in a health region. So let's examine a region that perhaps has a high rate of lower amputations for diabetes patients, lower extremity amputations. The rate's higher than the provincial average and the national average, and it's increasing over time. So let's now map that to the framework. We're going to pull up the visual and lay over the visual the different aspects of the system, the provincial system, to see how this problem maps to the framework and how the different stakeholders within the framework can work together to solve the problem. So starting with the outcomes component, which is always your ultimate goals of the system, we see the outcome is we want a better health status. But in this case, our health status is really focused on these diabetic patients that have a poor health status with these lower extremity amputations. So how do we improve that? If we work backwards and look at the outputs of the system, we'll want to look at whether or not the care that they're getting is safe in the hospital, so they're not getting infections, that they're not getting a lot of complications after their surgery, so we'll want to look at our data around post-surgical complications. And we'll want to look at how many of the diabetic patients are coming back unnecessarily. So you really don't want a high readmission rate for diabetic patients as part of your healthcare services and outputs. The inputs, when we think about that part of the framework, are really important too. So in this particular situation, you may have a provincial strategy for diabetes where you have a target goal to set that 80% of your diabetic patients are meeting those clinical guidelines around those regular visits to improve their care and to prevent things like lower extremity amputations. How many of them have access to a primary care doctor? That's an important aspect to think about as an input, because if they're not seeing their family doctor, they may be slipping through and getting more complications. What's the prevalence of diabetes? So you'll want to look at that too in your region and look at that over time. If you've got a higher prevalence, then you may need to target prevention programs in that respect. So that's an input that you would look at as well around adjustment to population healthcare needs. What about the resources? Are we allocating enough funds to treat diabetic care? So that's another aspect of inputs that we want to look at. Moving on to social determinants. Now this is one the system doesn't always look at closely, but it's a really important one. And that can revolve around things like structural factors. So the neighborhoods in your region, is there a lot of opportunity for walkability and people walking places? Because physical activity is very important to prevent diabetes and the complications that you get from diabetes. What are the diets and public health programs around promoting healthier eating around diabetes? And then who is active in their leisure time? So what are your leisure time activities? So those are all those biological, material, and structural factors that can affect this outcome that we want a better health status for diabetic patients. So if we bring all of this together and we think about the people associated with those dimensions, this encourages discussions about the health system and solutions and an action plan for improvement.